Dr. Curtis, now we're going to talk about atrial fibrillation. For the patients with the non-valvular atrial fibrillation, what do you tell them about their options for management and treatment?
Well, there are three key components to the management of any patient who has atrial fibrillation. First and foremost is the prevention of stroke. So you want to make sure that if a patient is at high risk for having a stroke, even if the atrial fibrillation only comes about infrequently, you want to make sure that they are on the proper drugs to prevent that. They go by the terms anticoagulants or blood thinners. So a patient would need to be on a blood thinner if they are at high risk. That prevents the stroke in the patient in most cases, but it doesn't treat the underlying rhythm itself. So when a patient has atrial fibrillation, the problems can be because the rate is very rapid or irregular or both. For rapid rates, we have medications that can slow the heart rate down, and that can reduce symptoms in many patients. Slowing the heart down by itself also does not regulate the rhythm. So the third component to what we think about in treating a patient would be to control the heart rhythm. And there are specific medications that will keep the heart in a normal rhythm in many patients and control that better. In that case, though, when we use medicines, if all else fails, there are more advanced options like something called catheter ablation, where we actually try to go in and correct or cure the atrial fibrillation itself.
So in summary, there are three things that we always look at in atrial fibrillation patient. One is the risk of stroke for the patient to prevent the future stroke. I feel very passionate about preventing stroke as well. And there are two other things, that is rate control with the medication. And for the patient who's really symptomatic from atrial fibrillation, we need to try to control their rhythm either by medication or catheter-based ablation.